Okay, let's cut across now to RS Sharma, who is in conversation with ET now, Ruchi Bhatia.
Very many thanks for that. Of course, the government has said that they will be opening up the third phase of the vaccination drive and will allow everyone over 18 years of age to get vaccinated from the 1st of May. Let's talk about that in detail, given the fact that the government today has said that the CoWIN app will open up registrations for all those eligible over 18 years of age from this Saturday. To talk about that with us is the CEO of the National Health Authority, Mr. RS Sharma. Mr. Sharma, appreciate you taking your time out and speaking with us today at ET Now. This is Ruchi Bhatia. The government has already said that those over 18 years of age can now join in the vaccination drive as well. Talk to us about how ready is the CoWIN platform to implement the new policy?
Well, since last couple of days that the government announced new policy, we have been working to ensure that the CoWIN platform is absolutely ready to implement the new policy of the government. And therefore now, as I said earlier to some of your colleagues, we are opening the registration of 18 years plus from Saturday onwards. So therefore we are ready. We also expect the traffic to go up considerably because now we are having a larger sort of age group which is eligible for vaccination. So we have readied the infrastructure also to ensure that people who use the platform do not have any inconvenience or do not have bad user experience.
Oh, absolutely. So, given the fact, sir, that you're saying that you're expecting a lot of interest also coming in, we are expecting the vaccination drive to really get the much needed bump up as well. There will be multiple vaccines in the third phase as well. Now that Sputnik V has also been given an approval by the government, we'll see the procurement for that also happen very soon. Talk to us about on the back end, what kind of changes should one really expect this time around, and how will you ensure that on day one, when there's going to be so much of traffic coming in on the CoWIN app, the app is able to sustain and take in the kind of traffic as well?
Well, Ruchi, one is a very important question. One is that the user experience of registering on the CoWIN platform and getting the appointments on that platform will remain same as before. The only rule which had changed which is going to change is that now the eligibility criteria will be 18 years onwards, number one. Number two, let us also understand that registering on the platform is one thing and getting an appointment on the facility is quite another. So that appointment one will be able to get only when those facilities put up their schedule of vaccination on the platform. So what we are requesting the entities, and many of them will be new entities who have not been doing vaccination earlier. So those entities, when they enter, we are requesting them that please register on the CoWIN platform so that you are able to publish the timetable, tell the price of your vaccines for the consumers, information, and also the kind of vaccines which you are sort of administering. So those things will be the new things, so to say. But once they publish the platform, then, people will be able to get appointments on that. That's one part. Also, let me also inform you that this time around, there will be, as you know, industries will be able to buy directly from the manufacturers, and they may buy for their own employees captive, sort of vaccination. And that they need not, make that whole schedule public. So those groups need not register on the platform. However, the vaccination, as and when that takes place from whatever means, that event has got to be recorded on the platform because we need to have the data of the overall vaccination progress in the country, the kind of adverse impact which this there may be some adverse impacts, and that data has got to be captured for the purposes of figuring out the future strategies.
Right.
That is non-negotiable in the sense that recording the vaccine is
Understood.
Real time.
Right. Those are two very important points that you raised. First, you've told us that, for private hospitals, you're expecting them to update on the app the kind of, slots that will be available. Given the fact that the private sector is yet to procure from the vaccine makers itself, do you foresee some sort of a delay coming in on that front, sir?
Well, that is not really my subject. My subject is only to ensure that the platform is ready to accept the request and the numbers and the registrations, and also we are able to, people are able to make schedules of vaccination. So that part is something which I am in charge of. And I am only talking about that. With regard to the availability of the vaccine, the purchase of the vaccines, that's really not my area of expertise.
No, absolutely, and I do understand that, sir. But what I'm trying to ask you is that what kind of intervention do you expect from the private sector? How is that process going to work, and what kind of conversations you're having with the private hospitals that will be procuring the jab and will be giving it to all those who are eligible in the third phase?
No, you see, we already have private sector as our partners. In the second phase also, till now, we are having private sector doing vaccination, but on behalf of the government. So that, I suppose, will probably either continue or not continue. That's a different issue. But central government, as you know, will be procuring 50% of the vaccines and will be continuing to supply vaccines to the government hospitals, who will be able to offer the vaccination services free of cost to the people of 45 years plus. So that's one part which you should understand. The rest of the supplies will go either to the state governments or to the private hospitals or to the industrial houses for their own employees, etc. So that will be basically the policies relating to pricing. The other kinds of details will have to be worked out by them. Only thing is that they will also be able to use the CoWIN platform for registering people on the platform for their facilities and then provide them the vaccination. So that
you're also right. So you're also telling us that if a private institution has procured the vaccines, and if they have a captive, captive people, for example, their employees who they want to give the vaccine to, then those employees don't need to register on the platform. However, the institution as a whole will have to do so, right?
The institution will. When they vaccinate people, whether they vaccinate the employees of the company, their own company, or they vaccinate other people, they will have to record the event on the platform, which is basically through a vaccinator app, which the platform has. As you know, platform has got 4 broad categories of applications. One is the application where you can register and you can get appointments. Another is when the vaccination is being done, then you can record vaccination. Third is basically issuance of the digital certificates of vaccination. And fourth is publishing on the platform your vacancies and schedule of vaccination by the entities. So these are the 4 components. They will still continue to use the component relating to vaccination, and that they will continue to upload the information regarding the vaccination as also.